Hello everyone. Welcome to the Understanding the Impact of Job Demands and Job Control on Work Outcomes webinar with Kelly Williams-Whitt. This webinar is part of our Return to Work, Stay at Work series, and we're glad to have you here with us today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Gaming Grants Program through the BC government, as well as through donations and memberships. As I mentioned earlier, my name is Tanya, and I'll be moderating the session and handling the Q&A today. And our speaker today is Kelly Williams-Whitt. Dr. Kelly Williams-Whitt is an associate professor in the Faculty of Management at the University of Lethbridge and chair of the Human Resources and Organizational Studies area. Dr. Williams-Whitt teaches courses in occupational health and safety, labor relations, employment law, human resource management, and workplace diversity. Her research is published in peer-reviewed scientific journals, and she has authored numerous books and book chapters on work disability and labor and employment law. She's also an active arbitrator and mediator, and we are very glad to have her with us today. She's also a board member with CIRPD, so we all also get to work with her in that regard, so that's a lot of fun. Kelly, I will hand it over to you.
Thank you very much, Tanya, and welcome everybody. As you can hear, I guess, from Tanya's introduction, I'm someone who has my fingers in a whole lot of different things, and I know a lot about a little bit of a few things and not very much about a lot of other things, so makes me, I guess, a jack of all trades and a master of none, as my dad would tell me quite regularly. Anyway, before we get started, I just want to acknowledge that I've got some artwork in here. The artwork is by Beryl Cook, and it's really purely for entertainment purposes, I guess. She does really lighthearted kind of paintings, and I enjoy them, and I think that sometimes when we're talking about some serious topics, we need to have something a little fun and lighthearted to look at. So today, what I want to talk to you about is the importance of job design for employee health and for employer success. So job design is really a core function of human resource management, and it's something, though, that, of course, return to work coordinators are involved with as well. And when we talk about job design, we're really referring to all the tasks or activities that are involved in a particular job. It's how we put those tasks together to create a single position, or how we divide them up among several positions. And when we do job design well, we should consider at least three things. We should be looking at the physical and psychological demands of the tasks. We should be looking at the skills and abilities that are required to complete those tasks. And then we should be considering task interdependence, or how the tasks actually fit with one another and how they fit with other functions inside of the organization. In really good job design, we should also be thinking about the resources that an employee might need in order to perform those tasks, and how much autonomy the employee has to decide when and how to get the tasks done. So unfortunately, at least I would say unfortunately, in the real world, organizations usually design jobs for efficiency. There are a lot of employers who also try to make jobs meaningful and motivating for their employees, but efficiency tends to dominate job design decision-making. Efficient, though, as we know, is not necessarily the same thing as effective, and a lot of organizations don't take into consideration longer-term costs that can be associated with poor job design. So today we're going to look at what we know about job design factors that influence work disability. We're going to look at interventions that address these factors and whether or not better job design can have an impact on employee health and on organizational outcomes. So let's get started. So in my presentation, I'll be covering a few key topics, and hope by the end of it that you've learned something new about addressing job demands, job control, and resources in job design. So I'm going to start by making the case for the importance of job design to mitigate demographic, health, and legal risk. And I realize I'm probably speaking to the converted with most of the folks that are listening today, but I always feel like I need to begin with the reasons why it's important to workers, to organizations, and to society as a whole that we address this. Then next I'm going to talk about how job demands, job control, and resources influence worker health. And then we're going to I'm going to be spending most of my time when I'm looking at resources. I'm talking more about work resources, but I will address some personal resources as well. Next, we're going to look at the research on different interventions that are intended to reduce job demands, increase control, or increase job resources like social support. We're going to discuss the impacts of those interventions on outcomes that are particularly important to organizations. So we're going to be looking at things like the impact on absenteeism, performance, and the costs and benefits of these kinds of interventions if employers implement them. And then finally, I'm going to talk about some new exploratory research that I've been doing that looks at how job design can influence managerial decision-making in the accommodation of ill or injured workers. So we all know, and we hear about it on the news often enough, that we're in the midst of a demographic shift. We've got a lot more older workers, many who are working past the age of 65. And we need to support the ability of those folks to work in order to maintain economic growth and productivity. Our aging workers are really very valuable assets to our organizations. They have institutional knowledge, they have experience and skill. We also know that as we get older, we're more likely to face age-related health conditions that affect our ability to work, including musculoskeletal issues, back pain, cumulative stress disorders, chronic pain, heart disease, cancer, dementia. I know it's depressing. If I keep going on, I can go on for a long time there, but I don't want to make us all depressed. So the slide shows, this one that I have up right now, shows some recent research from the University of Alberta. So these are Alberta stats. But it's a really important slide, I think, because it really looks at how that demographic change has impacted people seeking workers' compensation benefits in Alberta. So you can see, when you look at this, that 30 years ago, the average age of an injured worker was 35. And that worker was usually male, and about 86% of those folks got jobs again after their injuries, okay, or went back to their original employment. If we fast forward to 2012, the average age of injured workers has crept up by a full decade, and the average age in 2012 was 46. And perhaps what's more significant about this is that these workers, once they get injured, are much less likely to be employed afterwards. So this work was done by a team at the University of Alberta that included Doug Ross, and I've worked on a number of projects with Doug. And some of the other things that this group of researchers have found is that older injured workers are also, they're more likely to have fractures and injuries that they sustain. When they do get them, they tend to be more severe. They tend to have less education and are working in really physically demanding jobs or occupations. They get fewer offers of modified work and fewer offers of rehabilitation. So, it's a concern overall. And I mean, the reasons why this is happening are varied, but there are important implications for both employers and for society as a whole. And that includes the costs that are associated with income and social support for people who aren't working. We have skill shortages in certain areas. We have the loss of institutional expertise for organizations and knowledge and experience. And that doesn't even touch on, the impact, the emotional and financial costs to the workers that are injured and their families. So if I haven't convinced you just yet about the need to ensure that we're doing everything we can to prevent work disability for aging workers, I'm going to talk really briefly about the legal imperative. So most of you probably are quite familiar with the idea that employers have the duty to accommodate an employee with a disability up to the point of undue hardship. Exactly what undue hardship looks like is different for each employer and will vary based on the specific circumstances of the case. The right to accommodation is ensconced really in our human rights legislation across Canada, so it's very similar across the country. But unfortunately, as I'm showing in this slide, there's still a long way to go when we look at the number of complaints filed by social area and ground. So we can see on here that by far the largest number of complaints are filed for discrimination in employment on the basis of disability. And so I'd also argue, looking at the cases and with the background that I have in arbitration, that human rights tribunals and arbitrators were increasingly looking to employers to do more to ensure that people with health conditions are not faced with unemployment because of their disabilities. So we really are hoping employers can step up and do more to make this doesn't happen. I think particularly medium-sized and larger Canadian employers are going to have to show that they have a system in place for disability management and that the system they have is effective. So now that I've sort of made everyone a little bit sad about where we're at, I want to talk about how we can protect workers. There's really good news, and it's that I think employers can do a lot to reverse some of the troubling trends that we're seeing by actually addressing job design. And this page introduced to the model, and it's called to a model that's been around for a long time. It's called the job strain model, and it's particularly important for job design and for understanding how we can reduce the incidence of illness or injury for aging employees. Increase our return to work success when those folks do encounter a health issue. It's important because it's been really thoroughly researched, and while there's been some modifications and what we started at the time, the basic relationships that were governed and put into this model or shown in this model have been supported across a wide range of job types. So we've known for a long time that job stress is related to a number of health and productivity outcomes. So high levels of stress are associated with poor health, decreased productivity, increased absenteeism, and a host of other negative outcomes. And it was thought that high job demands should be the cause of high job stress. Okay? So job demands are things like the pace of work, complexity of the work or difficulty, the amount of work, the time pressures associated with tasks. But what the research was showing that relationship was not always consistent. Sometimes people in high demand jobs were more healthy and more productive. So Robert Karasek, who was an engineer and labor relations researcher from Columbia University, couldn't understand why this was the case. And he thought perhaps it had something to do with the amount of control or decision latitude that an employee was able to exercise in the job. So decision latitude or control is the degree of discretion an employee has to determine where and how a job gets done. And Karasek suggested that job demands and job control interact, creating 4 different conditions which would result in either motivation or job strain and accompanying levels of stress-related illness. So in the first condition, which is the green box, there is a high likelihood of strain because job demands are very high and job control is very low. And an example of a job like that might be someone who works on the drive-through at a Tim Hortons restaurant. So the demands are very high. The lineup at Tim Hortons in the drive-through never goes away. We all know that. And so it's consistent, and they have very little control. So they can't step away and change their job. They can't stop and take a break when they need to necessarily. So they have very low control. So that would be considered a fairly high-stress occupation. In condition 2, which is the purple box, the job demands are high, but control is also high. And this is thought to be motivating, and the research suggests that it is, because there's lots of opportunity to learn new skills, to be creative. So even though the job demands are high, the individual has enough control over their daily activities to manage those demands effectively. In condition 3, which is the blue box, we have a low strain job because there are low job demands and a high level of control. So there's not a particularly difficult job and might be a little bit boring, but there's not any significant health risks that we would see related to that. Finally, in condition 4, which is the yellow box, we would see employees who have low demand and low control, which isn't stressful necessarily, but it is probably pretty unmotivating, which can lead to apathy and boredom. So this slide, I'm showing you kind of how the research around Karasek's model has evolved a little bit. So we see it as an extension of Karasek's original theory, okay? And it integrates work from a number of other research paradigms. And the core assumptions of this model is that every occupation has unique risk factors or features that are associated with job stress. And the factors are classified into two general categories. One category is job demand, and the other category is job resource, or job resources. So the key changes that we see from Karasek's model, the original one, are the addition of emotional and physical demands. So Karasek was primarily thinking about psychosocial or psychological demands, and so we've seen the research actually expand and explore this, and we see the addition then to the model of physical job demands as well as emotional job demands. We also see that the model has been expanded to add to look at resources that mitigate or reduce the negative impact of high job demands. So autonomy would be pretty much the same thing as job control or decision latitude. Okay, so that's now not just a two-way interaction. We see a number of other potential resources that can help an individual deal with or manage a job with high demands. So autonomy is one. Support is another, which can include psychological support or financial support. Feedback from a supervisor can be another type of resource. So the model right now it's a matter of researchers taking a look and seeing what things are considered job demands and what types of things can be considered resources to help an individual manage those demands. And then you'll also see that the model extends beyond that individual health and stress impact to show its influence on organizational outcomes like absenteeism, productivity, and performance. So the main assumptions of this model, the Job Demands and Resources model, or JDR model, are consistent with the assumptions of Karasek's model, suggesting that job resources moderate the impact of demands on job strain and burnout. And the theory would also predict that when job demands are high, job resources play the strongest role in motivation. Okay, so now what I'd like to do is talk about the modifiable factors, things that we can change that influence work disability. This means that there are factors that lead to injury, re-injury, and stress disorders. So on the right-hand side of this chart, we can see that there are a number of personal determinants. So they're factors that have mainly to do with the employee themselves and or the particular health condition. So there's been quite a lot of high-quality research on this side of the house, particularly with respect to different interventions that may have a positive impact. So most of the research that's been conducted over here is by researchers from medicine and epidemiology, and that makes quite a bit of sense because many of those interventions are intended to address issues that are delivered by doctors and psychologists and social workers and that kind of thing. So, you know, working on the employees or the workers' attitudes and beliefs and their specific behaviors for fear and avoiding pain and coping and those kinds of things. The left side of the chart, though, is really where I want to focus our discussion today. These are the modifiable factors that can be adjusted at the workplace. So we are talking about physical and psychological job demands, the attitudes and practices of employers regarding their worker health and return to work. We're looking at the way that the work is organized, okay, so job design again, and support for employees with varying health conditions. So it's this side of the chart that deals really most directly with job design, and there's really quite a lot of research that tells us that these factors are important for reducing disability, but we know a lot less about the interventions that can mitigate these factors. So workplace-based interventions, things that employers can do or implement in their workplaces that will actually decrease the impact or the negative impact of these particular factors. So in the next few slides, what I'm going to do is show you what we do know about interventions designed to reduce demands, increase control, or improve social support. So we're talking about all of those parts to that model I just showed you and how we're going to try and affect, or the interventions that we're going to try and engage in to reduce the risk of poor health that arises from some of these workplace factors. Okay, so the types of interventions, we're going to just talk about this, that we're talking about include simple interventions for the most part. Did I go too far? Nope. I did one. Sorry about that. So the types of interventions that target job demands or job control, that's what I wanted to talk to you about. So when we did this is research that we did that I worked on with a team of folks from the CIRPD, and that included Mark White and a number of other folks, and we included some stakeholders in this research as well. So the types of interventions, when we looked at all of the research that had been done, the types of interventions that we found that target job demands and job control were typically either simple interventions or complex multimodal interventions. So simple interventions are things like job modifications to reduce physical demands or provide increased control over the pace of work, or allow a person to take extra breaks. They could be an ergonomic adjustment to reduce physical demands or cumulative stress injuries, or it could be an education program to help employees better manage their work demands, improve lifting techniques or stress management classes, that kind of thing. So these are single interventions, just one part of, one type of intervention that gets implemented. For the complex multimodal interventions, they usually have a multiple of different types of approaches that are delivered at the same time or offered at the same time. And so multimodal programs will usually include a combination of job modification, collaboration between healthcare providers in the workplace, supernumerary replacement. Oh, I'm proud of myself for saying supernumerary without fumbling it in my mouth. Ergonomic assessments and adjustments, return to work coordination, education, and early contact with workers who are outside, who are off work with an illness or injury. So we sort this. So this is how we categorized the interventions that we found in this research. So they were either simple, or single is another way to say that, or multimodal. And then we looked at who the interventions were targeting. So some of them are targeting workers who would be already at work or still at work. They might have health conditions or not have health conditions, but they're still at work at that time. Other interventions specifically target workers who are off work and coming back to work after a health incident. So we're kind of talking about things that can be categorized as primary prevention, or for those who are off work, secondary or tertiary prevention. Okay, so in this project, we conducted a systematic review and sort of assessed the state of the research on modifiable workplace factors. So we brought in some non-academic stakeholders, representatives from employers and workers' compensation board and those kinds of other folks to participate right from the very beginning of the research right through to the end. And so they helped us design the research question. They helped us to identify the types of outcomes that they were most interested in finding out about. And what they told us was that the outcomes they wanted to know about were related to employer concerns. So the impacts on absenteeism, productivity, and the cost versus benefit of implementing any particular intervention. So I need to tell you, this is a very high-level analysis. So we're looking at the forest here. We're flying at 10,000 feet. We're looking at the forest. We're not examining every individual study. We're looking at, systematic reviews of individual studies. So we're not looking at trees or branches or leaves. We're looking at the forest here. So when I'm talking through this part, when I talk about evidence that's strong or moderate, this means that there are a large number of good quality studies that have been done already, and their findings are very similar. We talk about limited evidence if there are a few good studies pointing in kind of a positive direction, and we say that there's insufficient evidence when there is not enough work that's been done for us to judge it. And then if the studies are showing conflicting results, we would call that inconsistent. So those are kind of the terms that you're going to see on the slides here. You're going to see strong evidence, moderate evidence, limited, insufficient, or inconsistent. So I just wanted to be clear about what those different things meant or mean. So what did we find out? We found out basically that there's a lot of research on reducing job demands, and it's quite clear that engaging in this reduces work absence. There's a good relationship between that and work absence, and it's very consistent, and there's quite a large number of studies about this. It's effective for both workers who are at work already or still and off-work workers. So it has a preventive element and also sort of a secondary and tertiary prevention element. Multimodal interventions, we know, are better than simple interventions. So when we sort of put together a program and target a number of different things or try to do a number of different interventions at the same time, we know that that works better than just trying to do one thing like an ergonomic assessment. Both are effective, but multimodal is more effective. There's less information about reducing job demands for at-work workers, so more work has to be done there to determine if it's effective for primary prevention. Generally, the financial benefit of reducing job demands outweighs the cost. So more work has to be done with respect to the impact on productivity. There wasn't really enough information for us to make that call when we were looking at it. So we need more work generally to assess performance for injured workers in these programs, though it's kind of challenging because we kind of expect variations in productivity depending on the stage of recovery. So on the whole, with respect to job demands, this is the information, this is the level of evidence that we were able to find about job demands. So when we look now at the interventions that increase job control, they're the same or similar types of interventions to the ones that reduce job demands, although there's some that very specifically target job control. And we found fewer studies about the effect of increasing job control. So there aren't as many of those as there are studies that really look specifically at reducing job demands. So what we found is that the evidence is moderate for its effect on absenteeism. Okay, so it decreases absenteeism and it improves productivity at work. Okay, so increasing control, the evidence suggests that it increases productivity and decreases absenteeism. We didn't have enough, there weren't enough studies that actually looked at the impact of increased control on the cost side of the house. We had insufficient evidence there. And most of this that I'm talking about, these effects, are for at-work workers. So we need a little bit more information about, we need more studies to be done to be able to state what the level of evidence is for off-work or injured workers when we increase the job control that they have. So now I'm going to talk about the interventions that address the resources portion of that job demands model. So social support's a resource that can mitigate the negative impact of high job demands combined with low job control. Okay? And the types of interventions we found that addressed resources included leadership training for supervisors to teach them more effective communication skills so that they can offer stronger support for returning workers or for their workers in general, training to increase their understanding of mental health issues in the workplace, employee assistance plans for a type of support or resource that could be made available to employees. Telephone outreach was another one of the interventions that we studied or that we found research on. So telephone outreach specifically to ill or injured workers. And then for those who are off work, structured collaborative return to work consultations and coordination, which include, you know, the worker, when we talk about this, we mean that the worker is included and part of that process in terms of determining how to modify the job and the workplace for their return. So, as expected, when there are more resources to help workers manage their job demands and other potential stressors, whether they are off work due to illness or injury or not, there's a positive impact on absenteeism. So the level of evidence is moderate, meaning there are quite a few high-quality studies, and the results across the studies are consistent. There's also a moderate level of evidence showing positive impact on productivity, which is good to know, as well as net financial benefits of offering these types of interventions. So when I'm talking about net financial benefits, I'm saying that the benefits outweigh the costs. These kinds of studies tend to report a return on investment for the particular intervention type, and so we say that the cost outweighs the benefit, or the benefit outweighs the cost, sorry. There are fewer interventions that specifically try to address supervisor support of their workers or the quality of supervision, and it's important, this is an important feature, I guess, because we know that supervisors have a really substantial impact on return to work success. And so although the work is in its early stages, the evidence is limited, it's trending in a positive direction, that if we work with supervisors, the impact on absenteeism, productivity, and cost effectiveness can be positive. Okay, so just to sort of summarize where we're at here, our study suggests that we can be pretty confident in saying that job modifications that reduce job demands and or increase job control can reduce absenteeism and are generally cost effective. We can say that increasing the amount of control an employee has over the work that they perform generally improves productivity. We can say that multi-component programs, when we offer a suite of options, tend to be more effective than really simple single interventions, like just an ergonomic adjustment. And we can say that the evidence is mounting that resources, including social support types of resources, decrease absenteeism, improve productivity, and are cost effective. So, of course, the kind of research that we've just done tells us a lot of what we know, but it also tells us a lot of what we don't know and what we need to understand a lot more about. And some of the things that we do need to know more about are things like psychosocial job demands. There's less information out there about how much attention employers pay to psychosocial job demands, what interventions they're using or trying, which ones are effective to reduce the negative impact of those high psychological demands. What's the role of the workplace conflict, and what kind of interventions might reduce the stress associated with conflict. How much influence do coworkers have, and are there interventions that can ensure coworkers are resources rather than demand, increasing demands on returning employees and supervisors. And a lot of these studies had sort of a short turnaround, so we couldn't necessarily see what the longer term impacts were of the interventions that were being tested. And then another thing is that we wanted to know more about, or that this sort of led to, is questions about how supervisors actually make decisions about return to work, and how can we help supervisors make better judgments about return to work. And this last question is one that I've spent some time on in the last couple of years, and that research is what I'm going to be talking to you about next. So in order to understand better what's happening with supervisors, I conducted some research with a team that included Vicki Chrisman, who is at Lakehead University, and Paula Reguli, both of them associated with the Institute for Work and Health at University of Toronto, Bill Shaw from Liberty Mutual in the United States, and these might be names you're familiar with if you're if you attend these webinars very often. At any rate, since we don't know a lot about how supervisors think, the best way to get started is to do qualitative interview research. So what I did was meet with 23 supervisors from a wide range of occupational settings: healthcare, transportation, retail, construction. I had male and female supervisors, and I spent an hour, hour and a half, sometimes 2 hours with each person. And I asked them questions about their decision making and what happens when they're making decisions about return to work for employees who have back pain in particular. And so we were narrowing it to back pain because that's a really common kind of an illness or injury And it's something that a lot of employers would have to deal with, so we would be able to find a number of people who could speak to that. And I was interested in knowing what kind of role job demands and job control and resources might play in their thinking. I didn't find exactly what I thought I would, but I did find some really interesting things. So when talking about this, supervisors and managers really described two aspects of job accommodation from their perspective. So first they talked about the process of decision making, and the second thing that they talked about was the experience of it. And so when they were talking about the process, they were really consistent. So, you know, you can see on this slide I've got sort of this image of gears grinding and turning, and they sort of talked about this idea that accommodation is a trial and error process, and the more they repeat it, the more difficult it becomes for a particular, you know, if you're repeating it for the same employee in the same circumstance. And then the more times they repeat it, the less likely they are to have success when they actually, or, you know, success at actually returning that employee to the workplace. So the first thing they think about is whatever information they have about the employee's medical restrictions. Then they look at the employee's job to see how it might be modified to fit those restrictions. And it's a kind of a brainstorming process that the manager might do on his or her own, or it might occur in collaboration with a return to work coordinator or someone from HR, or maybe occupational health and safety. In any event, they describe a brainstorming process followed by trial and error experimentation. They bring the employee back to work in a modified job, they hope it'll work, and they monitor. And it's, you know, considered relatively simple and straightforward unless there are reasons that the accommodation becomes complicated. So this might occur because the employee is not recovering as expected, they aren't able to perform the tasks that are assigned to them, they get re-injured, or maybe if the illness or injury is chronic and unpredictable. And so they have to keep revisiting that same accommodation process. When that happens, when the return to work is complex, and the supervisor has to kind of cycle through that decision making many times over the course of years, there's a great deal of uncertainty. It becomes a high demand activity for the supervisor and creates stress for the manager and supervisor. So you hear this, and you know, the quote I've got on this page is, "That long one was a killer. I had no clue. What am I doing? I didn't know what was going to happen next. Is she coming back? Isn't she coming? How long am I living with this?" And then as one of the supervisors put it, for some of these people, and this sounds terrible, but the manager here, the supervisor here was expressing a genuine frustration with the process. For some of these people, you just hope that they get accepted for long-term disability and just disappear. It's a very evocative comment, but so I think it's important that we kind of understand that this has an impact on the folks who are making these decisions about how to return someone to work. It's, you know, this experience then, so they talked about this process, this repetitive brainstorming process, and then how that affects them, and it's that experience of accommodating these complex cases that I really want to talk about in these last few minutes, because supervisors describe how the process creates demands as well as the resources that can help them better manage those demands, which they often feel they're not well equipped to handle. They don't know how to do this. They aren't trained to do this, and so it's a learning process for them. So let's talk about the demands first that they identified that were associated with return to work. First of all, they pointed out productivity demands. The supervisors I talked to indicated that regardless of the need to accommodate, they still have to ensure the work gets done. And that's particularly challenging if the return to work is unpredictable. They may have to hire temporary replacements. They may have to substantially redesign work processes, which is time-consuming and not normally something they're provided the extra time or financial support to do. So you have the comment there from the manager who talks about it being like a balloon and squeezing the balloon in one spot and thinking they've got control of it, and then it just bulges out somewhere else. Another demand that arose in the return to work context was peer conflict, and I'm sure that this isn't new to any of you. This, they felt, was more likely to occur if peers had to pick up the more challenging work, so that the returning worker was not, you know, that the returning worker wasn't able to do. So if we load that work onto the colleagues, we see an increase in the level of peer conflict. Conflict might also erupt where, peers are, if the peers are questioning the legitimacy of the health condition or the fairness of an accommodation. Some types of health conditions might affect the returning worker's personality. They might, the returning worker might be a little harder to get along with. They might be tired. So regardless of the cause, what happens is it increases a demand for the supervisor. They have to deal with the conflict. They have to manage that situation, and they have to try and address it, and that can be psychologically demanding in addition to the time that it takes. Employee motivation is a demand-side factor, and this was interesting because we're talking about the motivation of employees returning to work after illness or injury. And the supervisors talked about finding it difficult to manage both the employees who are less motivated to return, and that might be because of fear of pain, fear of re-injury, and then they found it also difficult to manage employees who were extremely motivated. And so those are the folks who weren't following their restrictions, and they required, at least these supervisors said that sometimes those are the folks that required the management. They had to be monitored really much more carefully to make sure that they weren't exceeding the restrictions and doing things they shouldn't be doing just because they thought that they could. I've already talked a little bit about the frequency and complexity in that first slide, but the idea that, demands increase. The more often they have to address accommodation, the more complex the accommodation, the greater the demand is for them cognitively and in terms of being time consuming. And finally, I want to talk about the idea of risk. So a lot of the managers that I spoke with were really afraid of making mistakes. They were really quite terrified of injuring their workers. And so, they felt it was a high-risk decision about really personal issues that they might not be very comfortable talking about, and they found that very stressful. So on the resource side, the resources that they talk about included information, their past experience, autonomy, and the degree of organizational support that they received as helping them to make better and more effective decisions and to manage the demands that came along with accommodation. So of course, if the resources aren't available, or if the information isn't available and or isn't accurate, that can become an additional demand because the supervisor then is constantly looking for new information or clarifying the information. So I suspect that everyone who's participating here has heard complaints from organizations about the accuracy or quality of information they receive from physicians. And so this is like that bit of information, the medical restrictions, that's a big anchor for all of the other brainstorming and decision-making that supervisors do. So it's really crucial that information be as accurate as possible. And so if they don't have accurate information, they're very fearful of making wrong decisions and re-injuring their workers. So, that's one piece of information that can become a demand if they don't have it. They have also, they look at the job demands of the occupation that the employee is returning to, but a lot of the times this is just them guessing. They don't necessarily have access to any kind of formal job demands database or information that would tell them exactly how heavy the objects are that their employees are lifting, or whether or not the, what the psychological demands are, or how often they have to, how repetitive a task is. They don't necessarily have access to that information. They don't have a lot of access to information about employees' other abilities. A lot of this might be housed in HR, but it isn't necessarily given to the supervisor, so they don't necessarily have access to that. In terms of other resources, past return to work experience. So if they've had to do an accommodation in the past, if they've buddied with some other supervisor that does that, if they've got some experience with it, that's helpful to them, and that's a resource for them. Autonomy, again, their ability to actually make the decision, decide how to go about the accommodation. It supports their ability to manage those demands because they can be creative. They can come up with alternative ideas, and if they have the authority to actually implement them, that makes their lives much easier in the long run. Certainly they need policy and procedure to guide them, but the freedom and financial autonomy to act in the way and to actually create the right kind of accommodation is something that really helps them manage the demand of that. And then, of course, when they were talking about organizational support, really they are talking about support from their colleagues, support from a supervisor, that kind of thing. So they have some sense that someone else steps in and will pick up some of the slack, some of the work, and lift some of the work off of them, some of their other job duties, so that they can focus on a particularly challenging return to work or accommodation scenario. So on this slide, I've just really replicated that job demands and resources model that started off with Kurasek, and we ended up with Becker and Demerudy's kind of version of it. And you can see how the job demands of accommodation for supervisors potentially impact their motivation to do a good job of accommodation, as well as their own health and stress levels. And I guess I see this as kind of an important aspect of employee health from a broader perspective. We need to think about engaging in job design that considers the job demands and resources for workers as well as their supervisors. And I think we have to sort of be thinking about it as a whole system. So what are the implications of that? Well, I would say that we know from the research that's been reviewed earlier that decreasing job demands reduces absenteeism and is generally cost effective. We also know that increasing job control improves productivity, and that multi-component programs, multi-pronged approaches, are the most effective. It also tells us that supportive resources help to decrease absenteeism, improve productivity, and are cost effective. So although the supervisor research I talked about just now is qualitative, and the degree of additional stress caused by accommodation, or asking supervisors to accommodate hasn't been shown through empirical testing, though I do have a grad student working on that right now. Inductive reasoning suggests that if we want to improve the quality of supervisor decision-making for job modification and return to work for employees with disabilities, we need to look at job stress for supervisors as well, and we need to look at stress in a holistic way. So we can think about this as, return to work decision-making, planning, and implementation is itself a high-demand activity requiring a lot of cognitive effort, and much more cognitive effort than something that's really routine to a manager and less risky. So it increases the cognitive demands. Adequate resources are really necessary to enable and motivate supervisors. If we want them to attend to accommodation decision-making, if we want them to focus on it and do a good job of it, we have to give them the necessary resources. High accommodation demands combined with insufficient resources are going to cause stress and strain, which are going to impact the accommodation attitude and effort, and that in turn is going to impact brainstorming, the quality of their brainstorming, the quality of their creative accommodation efforts. And it's also probably going to impact or influence return to work communication, how they communicate and interact with those employees who are undergoing an accommodation for their own health issues. So I guess I would say if we want return to work, if we want supervisors and return to work coordinators for that matter, to have the cognitive capacity and motivation to address disability and return to work as effectively as possible, we need to address stressors for them as well as the people for whom they're responsible. And that is the end of my presentation. Thank you all very much. And we're going to celebrate and open it up to questions.
Wonderful. Thank you very much, Kelly. That was a really great presentation. We do not have any questions right at the moment, so I encourage people, if you have questions for Kelly on any of the items that she discussed or something else that comes up that you think she might have some expertise on, please feel free to enter those questions now. And I did get a couple of questions just so that for anyone who missed my announcement, we are recording the webinar and I will be posting that online. So I know there were a couple of people who asked, so I'll be sending out a link to that hopefully next week. Let's see, we did get a question. After decades at this work, how an EE feels about their job and supervisor is a key to success. Have you explored those factors?
Yes, actually, some of the research that I've been engaged in looks at something called leader-member exchange, and so that really is, it's the idea that it's a two-way relationship, right? The relationship an employee has with their direct supervisor, and the impact that that has on the employee's health and well-being, and certainly on their recovery and resilience. And you know, the findings there certainly are supportive of the fact that, or the idea that the higher the quality of that relationship, the more resilient the employee is likely to be. We also know from that research that employees see their relationships with their supervisors quite differently than supervisors see their relationships with employees. Supervisors who see their relationships with employees who are ill or injured or have work disabilities, they see them more positively than the employee sees that relationship. So that's kind of not surprising. So I'm exploring work in this area as well. Don't have as many results as I'd like yet, but absolutely it's crucial.
All right, great. Let's see. We don't seem to have too many... oh, wait. I just got a question. All right, let's see. I have a client with some psychological limitations. They're unable to work at tasks with frequent customer contact, deadlines, time pressures, high expectation for productivity. Do you have any suggestions for how to reintegrate this type of worker back into the workforce with a new employer in the open labor market?
Oh, wow. That's a hard one, because I think, for me, I would really have to start with what, not so much what that person is not able to do, but what are they able to do. So what skills and abilities, what's the knowledge, what's the background, are they, you know, what skills do they currently have, what's the education, and what's their past experience. It sounds like it's customer service kinds of work in the past, but that this might not be the right kind of work going forward. So I would, you know, that's a tough question to answer without knowing a little bit more about the person that we're discussing. And I think there is a whole lot of work that needs to be done in terms of understanding what jobs are less psychologically demanding. That's one of my points in one of the earlier slides, is that psychological demands are not really measured very often for a lot of types of work, but it sounds like you have a good handle on what this person, you know, the things that are going to be highly demanding for this particular person given their psychosocial or psychological health condition or mental health condition. And so I would then go back and look at what it is that they are capable of doing. What are, you know, and if there's telework or home-based work, and those kinds of things that might be appropriate for someone like that. But again, kind of depends on what the background is and what they feel they still have as a skill. And sometimes, and I know you know, there's a lot of people who would probably think I'm a bit, I don't know, Pollyanna or something, but I firmly believe, and this is a new area of research I want to get into, is that when we encounter health challenges, that creates certain types of it changes our abilities. It takes away some things that we might have been able to do before, but I also think it tends to make us better at certain things, and we might have to reflect and think really hard for a while about what it is that experiencing that has made us better at. But sometimes that actually adds skill to a person's skill inventory if they've had to face something really challenging. And it actually makes you better at certain things. You know, I think about people with, you know, something like OCD, right, where someone who has that might be particularly skilled at a job in a library where it involves sorting and organizing, and that might be absolutely the best person for the job, that you'd never find anybody else who could be better at it because their natural instincts are to sort and organize. And so, I sort of answered your question, but I know I haven't answered it as well as I would like. Tanya?
Oh, sorry. I had myself muted. Okay, let me try that question one more time. Have you looked into sense of entitlement or similar of receiving time off, i.e. limited benefits, or I mean LTD benefits, when looking at your trend slide in regards to age and percent of individual who return to work?
No. No, I haven't looked at entitlement as a factor there at all. That's not one of the topics that I have that I've investigated. I know there's a lot of employers who feel that this is a concern, right? That there are certain workers who feel as though, they have, if they have some kind of injury, that they should automatically be allowed to or given time off work, and I think it's kind of a stereotype in a sense that we struggle against in many ways, because we want workers back in the workplace more quickly. All of the research tells us that the quicker that we can return them to the workplace, as long as they are past that really acute stage of the illness or injury, if we can get them back earlier, at least in some capacity, early and safe, right? That is where we see the reductions in the long-term disability. So we need to convince employees that this is good for them and that it's, in addition to convincing supervisors and employers sometimes that this is the most effective practice. And so I haven't assessed that in terms of a factor that might reduce an employee's, I guess, their readiness to return to work. There is research out there on an employee's readiness to return to work, but I don't think that piece is, at least to my knowledge, entitlement isn't an aspect of it. It tends to be more fear-based, the research in that realm.
All right, and then one more question. Someone asking about examples of the role of unions in supporting processes for return to work.
Okay, so some of my earliest research on this, I spent a fair amount of time with union representatives talking about return to work, and I think initially there was some difficulty, when the first, the duty to accommodate became a legal requirement, but all unions are bound by that. It's a tripartite sort of a relationship where the union is also required to cooperate and collaborate. And I think you've seen in the last, since very early on really, you've seen unions shift in their thinking, and they've become tremendous supporters of return to work. Their challenge, of course, is in terms of balancing their obligations to other workers and the needs of the collective agreement. But one of the examples that I can think of, I was speaking with a union rep from a healthcare institution, and she was talking about the fact that sometimes when an employee is coming back to the workplace, you can have a manager go in and try and legitimize the return to work and legitimize the illness or injury without providing, of course, details. Just saying, such and so is coming back from leave. All of you know that she was off work, and so here are the things that she can do, and here are the things that she can't do. Don't ask her to do things she can't do. This is legitimate. She genuinely has a health condition that prevents her from doing these things. Having the union do that with the workers in that particular context was more effective than having a manager do it because of the particular trust context that was occurring in. So what I've seen is unions in the last couple of decades, unions fighting very hard to ensure that workers are accommodated appropriately, sometimes they get into a difficult situation with seniority and the collective agreement when we're trying to be creative. And so bringing them in as early as possible into the discussions about how you can modify jobs or pluck certain duties from other places, bring them in. If you're in a unionized environment, you want them on side and they can help. And then I guess just recognizing when they do jump in that they might have some suggestions that that the supervisor might not think of because they have knowledge of the organization as a whole.
All right. Wonderful. I think that's everything then. Thank you very much, Kelly, for the presentation, for answering the questions. I think it was really insightful and helpful.
Thank you, and thank you everybody who stuck through it.
Wonderful.